In 2023, the government released their Stable Homes Built on Love paper, which set out a series of reforms to children's social care off the back of Josh McAllister's review of the social care system. We were able to bid to become a pathfinder to test out these reforms and were successful in that bid.
The Pathfinder is broken down into 4 pillars. So the first one is about multi-agency safeguarding partners, and the push for that is so that we have closer links with education when it comes to keeping children safe. The second pillar is around family help, so making sure that families are supported from the right people at the right time. And that can range right from the family hubs that are based within our community, which offer all sorts of different services, right through to when a family needs more support around safeguarding aspects. So making sure that practitioners who have got the right qualifications and skills to be able to support families do so and can act as lead professional.
The third pillar is the creation of a multi-agency child protection team. So this is a move away from the traditional approach to child protection conferences and is a multidisciplinary team of experienced safeguarding professionals who will support families who are at risk of significant harm. It's much more a move towards working with families to influence change and safeguard children. The fourth pillar is the idea of family network, so unlocking the potential within the family system, really harnessing the support that families can give to children at risk and really building them into the plans around our families.
So in response to the Pathfinder, we have done some restructuring of our teams. We are now made up of 3 family help teams, which are locality based, which complements the early help offer, utilising the resources that we've got. Within those family help teams, we have social workers, but also family health practitioners. So practitioners who have worked with families for an awfully long time, have all sorts of skill sets that they can then bring into practice working with families directly. Also a multi-agency child protection team, which is made up of experienced social workers, but also partners from different agencies that can also support with safeguarding children. So representatives from police, education, health, and even a clinical psychologist who can support with the assessments of some of our more vulnerable families, which will be a huge opportunity.
So in Warrington, we've been on a really exciting transformational journey to family hubs. So 10 years ago, we have 6 children's centres, the legacy of Sure Start. We've now got 7 children's centres. We've opened up an additional one over in an area of Warrington that data told us we needed to open up and offer some support for our families over there. So those 7 centres are roughly around the same time, about 10 years ago, we changed our delivery model. We transformed our delivery model in the centres. So traditionally, Sure Start centres are just for those younger age group of children. We changed our delivery model so that we supported families with children 0 to 19 or up to 25 with SEND. The services out of those children's centres, we have children's centre practitioners, we've got a family support service, parenting team to support parents. We have other partners in the building such as midwifery, health services, running developmental checks. We have some charities that run out of the buildings as well, that offer a supportive service to parents with children with disabilities, early years, Citizens Advice Bureau, you name it, we've got them in there. So they're really, really well established children's centres with that integrated delivery model. With the transformation into family hubs, which we probably started our journey around 2022 with the emergence of family hubs. Unfortunately, Warrington didn't receive any funding for family hubs. However, we've got a really good foundation to build on. So we started our journey by going out to our parents, carers, children, young people to say, what would you like in your family hubs? What would you like them to look like? And we got some really, really constructive feedback. Some children, young people said, oh, we thought those children's centres were just nurseries. We didn't realise that they were for the whole family. So that really made us think about the branding of our family hubs as well and what we wanted them to look like and be a welcoming place for all families, still up to the 25 age bracket as well. We engaged with Warrington and Vale Royal College and their graphic design students to design our logo for family hubs. And it was a really exciting project. So it was the first and second year students at the college We went in, we gave them the brief, and they just got it straight away. So the winning logo is the Family Hub logo that you'll be able to see. We will launch the first Family Hub April of this year over in the Dalham area of Warrington. The aim of Family Hubs is for them to be more accessible for families, to be more connected to families, and also to build on more positive relationships with families as well. They're a one-stop shop, so a child, a young person, a family member should be able to think, I need a service, I need some support, I'm going to go down to my Family Hub and I know I'm going to get it from those people in the Family Hub. We will continue to develop in that integrated way, expanding on the services that we've already got in there to have an outreach model, but also to have lots of different activities going on in the Family Hubs as well as bringing those key partners in.
So the Family Help team has a team manager, a senior practitioner, then we have qualified social workers in the team, and then we have Family Help practitioners. So our Family Help practitioners, they come from a wide range of different professional backgrounds. So for example, in our team, we have a Family Help practitioner who was previously specialised in working with domestic violence. We have another Family Help practitioner in our team who's previously had nursing experience. So they bring lots of diversity to their experiences, and part of that makeup of the team is that it really helps our families when it comes to allocating cases, but also when it comes to supporting families. It's been really helpful in allocating cases where there's a risk of domestic violence, for example, to that practitioner to hold that case and support the family. And I would also say there's been a lot more joined up work, so for our social workers also co-working some of those cases with the Family Help practitioners and having those two different perspectives on supporting families has been really helpful.
So I came from a background of providing intensive intervention to families around where there was vulnerabilities and risks, kind of a whole heap of different things, kind of domestic abuse work, parenting support. I'm trained in delivering the Nurture Parenting programme, so that's a skill I've kind of brought with me, and I can utilise that in my new role. So we kind of covered all sorts of different areas really. So in my previous roles, we've just been kind of a support service to the lead professional. So it was always difficult to kind of push plans forward, and we didn't get a massive say in what happened with the plans, whereas this time in this role the plans are ours and we're kind of leading that and delegating to other professionals and making sure that plans are moving forward, and that's a big change for me, in that we get to see kind of how it progresses. Another plus is kind of some families prefer not to have the title of a social worker attached to their family. I had a family and had a child, and he was very kind of worked up about the thought of me being a social worker, and when I explained to him I'm not a social worker, that's not my role, the difference in him and the way he opened up to me and he relaxed a lot more, and it made a big difference. So I think that helps for some families because they don't like that kind of stigma, I suppose, that comes with having a social worker.
We're in different localities, aren't we? So what would you say are the benefits for your locality? I
think the benefits are massive in terms of the professional group. I think you get to know the professionals because a lot of the other professionals are locality based, so you get to know the professionals in your area, so the schools, the health visitors, all of the early help support that's available, they're all locality based.
Yeah, I think for our team, something we've really utilised is using the family hubs in the children's centres, and that being so much more easier to have a face to a name of some of the early help practitioners we're working with, and basing ourselves in the community where we're working. And for our team as well, we've found it much easier to spend more time with our families in the community because we're not travelling across the whole of Warrington. We're kind of just in our area, and we've even had some of our social workers walk into visits together, which has been nice.
So the multi-agency child protection team is made up of lead child protection practitioners with a wealth of experience in child protection. They work alongside our family help teams to support them with families that need support at a child protection level. So our lead child protection practitioners work alongside the family help team. They support them through the decision making in respect of whether a family should be subject to child protection planning, and we'll work alongside the social worker that works with a family to come in at the right time and to step out when needed. This allows the family to build up their relationship with their allocated social worker, but also have the experience of the child protection practitioner. So the multi-agency team consists of police, education, health and specialist services such as BABs and drug and alcohol workers, to work alongside the lead child protection team and the family help team to make sure that we've got the right support at the right time for all our families.
So we provide a broad range of support for our families around that family relationship and networks. We've got our family time team who supports that significant relationships when children have been removed from their parents. We look at our lifelong links, so they do a lot of support around our children in care, so to rebuild those significant relationships, whether they've been disconnected over time. So we look at those connections. We've got our family group conferencing, and we have our family network workers, so they currently provide a lot of support, intensive support around our family parenting programmes. They manage our homeless 16 and 17 provision and any other needs of the service that the family help teams may need.
So the family group conference process is all about putting children and families first at everything that we do. So we will meet with mums, dads, aunts, uncles, cousins, sisters and non-blood family members, so that could be a friend, a colleague, a neighbour, and it's tapping into the resources within families and their own families about them coming up with a plan that works best for them and their family.
Joe, what do you think the benefits are to family group conference?
So the biggest benefit for me is if we think about our own families, is who knows you and your family best. It's the people in your family network. So that might be mothers, brothers, aunties, uncles, cousins, step-parents, neighbours, work colleagues. So the biggest benefit is tapping into that resource around who can help you, who can offer planned and regular respite, who can offer support around childcare, who knows when you're struggling, what does that look like, and first and foremost, what can we pull together out of the family to provide those strengths.
And it's all around the child, isn't it? So it's who the child
Massively. So we'll go and see the child, we'll go and see the young people involved, and we'll tap into them. Sometimes we'll do separate plans for the children specifically so they can identify who in their family network they can turn to for support when they need it the most.
So our family group conference coordinators like yourself, Joe, have got the opportunity to access the family network support package. So tell us a little bit about that.
It's going to be really, really useful because up to this point we've always been able to tap into the family and the wider family support, but this is going to give us access to some funding, some resources for aunties, for uncles, like I say, the people that have been identified. If their children are going there in an absolute crisis, what have we got? What can we give them? Sometimes children were sleeping on floors, put up beds. This will give us the opportunity to go out and get the things they need, whether that be bedding, whether that be clothes, whether that be a uniform, so that the children and the families are better supported.
Yeah. And this is identified through the family group conference process, is it?
Yeah, absolutely, yeah. Like I say, family group conference team's been here for a long time, and it's worked really well, but this will definitely enhance it.
Just making sure that our children can remain at home where it's safe to do so, rather than having that transition and that loss of having to go to foster carers or strangers' homes, which is going to feel really unnerving for them. So it's been really beneficial for our young children to be able to stay within their family network or extended family network.